Good afternoon, everyone, and welcome to today's panel interview on trends in digital dentistry. I'd like to welcome everyone and thank our panel members for joining us today. We're very lucky and fortunate to have Mr. Livio Yoshinaga here. Livio Yoshinaga graduated in architecture at the University of São Paulo and is specialized in developing the technological infrastructures of dental practices. Known as one of the fathers of digital smile design, the modern concept, together with Christian Coachman. He also creates and plans educational projects involving live case transmission in collaboration with renowned dental specialists all over the world. Laurence Kabba, country manager of the UK and Ireland, and is a product specialist for 3Shape, and currently educates, supports, and provides clinical and laboratory consultancy to dental professionals. We're delighted to have you all here. Welcome.
Thank you.
Thrilled to have Livio here, one of my mentors and long-time friends, and especially in the UK where he's presenting tomorrow and showing us and telling us about the trends in digital dentistry. So the last time we all met was at IDS.
Yes. And
that was fantastic. Really had a great time there and so many interesting things to see. So just like to get your thoughts about that walking around the aisles and seeing the products, what were the things that excited you? Where do you think IDS and the technological advances are going for today's dentist?
I think it was really exciting for us to see that now the industry as a whole is really accepting, utilizing and actually applying digital technology to get better clinical outcomes. I think I may be a bit biased in saying, but I'm incredibly proud as 3Shape as I feel that we really did steal the show with the launch of our Trius Wireless, but also obviously really showcasing the potential from our X1 CBCT scanner. They were two personal highlights for me, but I think to see that the industry now is really at a plateau where the acceptance of digital is where it needs to be is incredibly exciting.
Very nice. I have a very particular position for IDS. Very happy to see that 3Shape as a leader in intraoral scanning just took the wires out. That means that Trios 3 was already a great product. But they have to come up with something as a company, and definitely a wireless system can bring a lot of advantages. But I was happy to see that no new scanning revolution is coming, and which means new scanners are there, but why should you risk? And this is one of my points. What I saw a lot of new stuff, the 3D printers, about, 20, 30 of them, but still, there's not much to talk about. They are in the early stages, but already giving us, combined with intraoral scanners, the highest resolution. So a resolution, there's no more discussion. There's no more need to do models by impression and core models, because really everything that we need is there. And on the milling machines, it's very sad to see another 20, 25 new brands that in the next IDS they're not going to be there. So again, I would really think that the stage of digital dentistry has come to, as far as equipment and technology, has come to a plateau, which is everything is so much developed, they have to stop, because what is not developed is the mentality of the dentist to acquire it. And I'm very sad not to see booths and companies that will be willing to help the dentists, just to help them to choose what is best for them without trying to sell just equipment. Of course, if we talk about 3Shape, it's not their job to do that. Their job is to create the best product they can and deliver the best customer support. But on the other hand, I just feel sorry for the dentists and technicians walking at IDS. I think they get happy to be there, but really frustrated and pressured to make their decisions. So my view on IDS was positive for me, because the products and the technologies that we have invested our time to develop our concept are still there, up to date, and thanks God, I don't have a lot of more work to do. I think we reached, and now it's really time to scale up. It's really time to deliver this knowledge together with the products to the poor dentists and technicians that are totally lost if they never bought anything or tested anything.
Yeah, that's a feeling I got as well. I mean, there were so many people there, but when you were speaking to them, well, which one should I get?
Yeah.
And how do I choose which one it is? So do you have any advice about that? How can they do that?
I started in dentistry doing smile designs in 1986, right? And then the first big technology that we were using was video cameras and intraoral cameras. Intraoral cameras was a big thing. So I saw the industry saying, the dentist asking the question, why should I have an intraoral camera? 3-4 years down the road, the question changed. Which intraoral camera should I buy? So I think now that's the shift right now. So it's not about should I buy an intraoral scanner? No, which one should I buy?
Exactly.
And my advice, not because Laurence is here, but of course, there are two main scanners in the market that I would say that we have certified. Certification is not just scanning a model on the booth, it's scanning the mouth, taking this to design, milling the restorations and cementing. And of course, Master Kano, our master, has been very critic on the point of quality. And of course, Florin Kofar, Alejandro Pineda, and all you, Jameel, everybody that is involved with us has this specific eye that really demands high quality. So right now, the thing is, don't risk. Go with the players. Go with the main guys that are there forever, that you're not going to find surprises in the next ideas. They're going to be there. Of course, no company is perfect because local support is made by local people. Although digital is there, the whole business is run by people, bought by people,
Sure.
and used on people.
Absolutely.
So my advice is don't risk. Either you have 3Shape as a scanner, either you have Omnicam from SEDEC. Both are beautiful, beautiful scanners. Dentsply, I'm very happy that made the move that I've been waiting for a long time, which is opening the scanner as STL. So that means you can choose any design software that you want. Both scanners. They see a lot of us working with 3Shape, but they say, Livio, I have SEDEC, what do I do? Do nothing. What camera you have? Omnicam. So scan, send them over, and the lab, they have to be able to accept all the scanners, all the STL open files, design, and then get your final restorations to mill. So if I'm a dentist today, I would just go with one of those two players, unbiased. I have no commercial interest whatsoever, but those are the two scanners that I took my time to really certify.
Certainly when I bought my scanner, that was a very important consideration, and in fact the main one. Will the company be here, and will it be able to update it? One of the things that I really liked when we went to Copenhagen and we saw the implant studio, and some suggestions were made, and literally 10 days later at IDS, those changes were implemented, and I thought that was incredible, and that only comes when you have a good software team behind it. So with respect to the educational part of motivating patients, motivating the dentist and educating the dentist, how is 3Shape looking to push that along? Do you have a lot of partnerships, and do you have a lot of academy things going on to try and train the dentist?
I mean, you can take them down to, you can take from a macro or a micro perspective. We train very thoroughly all of our distributors in our product to give effective solutions in consulting and implementation to the clinicians to make sure they're giving a nice, easy timeline into the digital world. One thing I would sort of say, and just referring back to the sort of advice to a clinician, is always to slow down. That's typically what we teach to all of our resellers to teach as well. It's good to have fantastic ambitions with digital,
Sure.
but it's incredibly important to really take it back to the basics. Start small because you will accelerate and grow quickly. A lot of clinicians looking at digital technology aren't necessarily familiar with, have used or are aware of digital materials. And that's a fundamental part of what they need to learn about. How do you prepare for those?
Yep.
What is it to expect in terms of how they react through staining and glazing, as we were just talking, and colouring, and also functionality. So really take digital back to its bare bones, start very simplistically, but have a good, clear route and understanding. And this is where Henry Schein are really amazing at what they do, is that they're able to build and produce for people the right structure for education. We start here. Once we've reached this level, then we can grow to different points and move to different areas.
Absolutely.
And expand in the way that we were doing. Like today's implant planning course, it's mainly just to show people what can be done, but we take it back to individual stages and elements and then build accordingly. We've recently opened the 3Shape UK Academy down in Reading, and the core purpose of this is to ensure that we can get effective and efficient training through to our partners. But we're also going to be doing very high-level application courses for people to see that digital's a tool. There's nothing set in stone with it. Gone are the days of closed workflows and individual profiles. Your imagination almost is the key. It sounds a bit Disney, but it's true.
Sure.
If you have an ambition, you can reach it. As long as you've got the right surroundings and the right nurturing, you can do so. And we really want to implement much more advanced workflows with that as well.
I think one of the things that dentists find difficult is that they have to get a lot of equipment in addition to the scanners. So for example, you have to get the proper computer that's been able to handle the processing that's required from high rendering softwares. Now, one thing that I think is really great is the fact that you've got a lot of laptops that the dentists don't have to bring along their own, but you can utilize, that they can utilize. So basically try it before you buy.
Yeah, absolutely. I think, we try to find as many different systems in the marketplace that are suitable for the job and suitable for purpose, to give people the choice and flexibility. Some people prefer desktops to laptops, etc. So we try to give as much a broader option as possible with that.
Sure. So with respect to the training of dentists, I know you've been involved in trained 50,000, 100,000 dentists all over the world. Any advice for people like myself who are trying to get into the education side of dentistry? What should we be focusing on?
Regarding yourself, we learn from you. So that's one thing. For everybody else that is not really expert on that, I think you should go to the meetings. First of all, I don't think anybody learned anything on meetings. What they learn, what they find out is who are those guys that identify with my style. And because to learn from someone, you need to identify yourself with them. You need to really follow somebody that is dedicating their lives to that, because people are there are business that are really focused on developing things and then trying to make the dentist's life easier so they can just follow them. Following one of those concepts or groups, or there are so many good out there, will relax you on one side. Jump on that boat, let the captain drive you, and until they don't frustrate you, but make sure that you know when you need to take your decisions to buy your equipment, and be sure that that group is going to bring you or to give you a scenario that you can test before you buy, but not just taking the equipment back home. Having the equipment for a month or 2 months is not going to solve your problem. You have to have the equipment, knowing what to do with that, and the companies and the consultants and everybody needs to help the dentist to do that. So I think it's like experience the whole solution, and for me a whole solution is getting the patient to meet a patient today and cement the final crowns or final veneers at the end. And that I'll call one experience. Not stop at the mock-up, not just do the design, not just 3D print something, but a full treatment, a simple case, get through it, and find people that are find structures, educational structures that are more and more focused on that. And this way, it's going to be a no-brainer for you to invest. You invest exactly on the products they're going to tell you.
Because the solutions have been already
exactly, it's exhaustive tested.
Fantastic.
That's what they paid for. That's what they invest their time and money on.
Fantastic. So very quickly, we've got about a minute left. Any quick advice that you have for new people who haven't invested in the scanners, anything as yet for them to get into the digital workflow? Yeah,
absolutely. I think to find outlets of education that are teaching things that are attainable and relatable to where you want to go professionally. And I firmly believe that the proof of the pudding's in the eating, and speak to your local representatives who could bring a scanner to you, scan some patients, send those cases to your lab, work with your lab together as a team, because that you will grow professionally so much quicker with it, and you'll get a much more profound experience and understanding of what the digital workflow actually is, and that should inspire you well.
Fantastic. So I'd like to thank everybody for joining us today, and thank you, Livio, thank you, Laurence. It's been a pleasure having you here. Really looking forward to your talk tomorrow and seeing the new things that 3Shapes are developing as they come into the market. So thank you very much.
Thank you so much.